Nigeria, a sub-Saharan West African country of over 160 million people, has had a very poor record in maternal and child health. Until 2009, when the Nigerian government, with her debt relief fund, under the auspices of the National Primary Healthcare Development Agency, established the innovative Midwives Service Scheme, MSS. Rural areas were hardest hit in poor maternal and child health indices. The scheme is a public sector initiative and collaborative effort among the different tiers of government to enhance increase in the coverage of skilled birth attendants to reduce maternal, newborn and child mortality. Under the scheme, based on a cluster model, 4 selected primary healthcare centers are clustered around a general hospital with capacity to provide comprehensive emergency obstetric care. A midwife is deployed to each selected primary healthcare center to ensure access to skilled attendant. The Midwives Service Scheme at the moment covers 250 clusters with 1,000 primary healthcare centers and 250 general hospitals. To ensure community ownership and participation, there are ward development committees at all the primary healthcare centers.
The time baby no come, my heart not there settle. But the way baby come, I'm very, very happy.
I appreciate the MSS program because it reduced the child and maternal mortality rate. The death of the mother and the baby, it has been reduced drastically.
I want the MSS to continue like that because previous years when there was no MSS, in fact the deliveries and other things were difficult. But with their coming, everything has improved.
There is increase in the antenatal cases and then increase in the women that are delivering at the health facility.
At the moment, the National Primary Healthcare Development Agency has deployed over 4,000 midwives, 1,000 other health workers to over 1,000 rural health centers across Nigeria. These facilities comprise primary healthcare centers and linked referral general hospitals.
Mr. President has also graciously approved that we scale up on the Midwives Service Scheme using the Subsidy Reinvestment and Empowerment Program. We are going to take on additional midwives. We'll take on additional 2,000 midwives, bringing it to 6,000 midwives. We're also going to take on additional 1,000 facilities. So going beyond the 2,000 facilities that we have presently. And we're also going to deepen the scope of intervention.
Available statistics show that close to 27 million women and children are currently benefiting from the Midwives Service Scheme. The scheme offers comprehensive services which include antenatal care, delivery, postnatal care, family planning, and immunization. In its 3rd year of implementation, the Midwives Service Scheme has been a worthwhile journey.
Additional resources are being channeled to expand the midwifery services scheme to deploy more community health workers, village health workers, as well as a conditional cash transfer for pregnant women in rural areas. That is building on already a successful program which has increased antenatal care and reduced maternal mortality in those areas where the scheme has been implemented.
Despite the progress accomplished in the implementation of the Midwife Service Scheme, security issues, local and state governments' default on counterpart agreements, availability and retention of qualified midwives are major challenges facing the scheme. These challenges call for concern from state and local governments, international community, development partners, and related agencies.
Not just the responsibility of the federal government, but indeed other tiers of government. But beyond government, the private sector has a big role to play. But ultimately, the individual has the greatest role. But who will lead, as a responsible government, provide facilities, provide human resource for health.
This support is crucial to complement the federal government of Nigeria's commitment, political will, and determination to make the MSS completely achieve its mandate of improving the lives of mothers and babies in Nigeria.